Hemophilia is a rare genetic disorder that affects the blood's ability to clot. This condition is primarily inherited and is caused by a mutation in one of the genes that provide instructions for making the clotting factor proteins needed to form a blood clot. These proteins work together in a series of complex chemical reactions to stop bleeding when a blood vessel is injured. Without these essential proteins, the blood clotting process is disrupted, leading to prolonged bleeding after an injury, surgery, or even a minor cut. Hemophilia can vary in severity depending on how much clotting factor is in the blood. Severe cases may result in spontaneous bleeding episodes, while milder cases might only cause problems after surgery or injury. It primarily affects males, although in rare instances females can also inherit the condition. This is because the genes responsible for hemophilia are located on the X chromosome. Males have one X and one Y chromosome, so if their X chromosome carries the hemophilia gene, they will have the disorder. Females have two X chromosomes, so they would need to have the hemophilia gene on both X chromosomes to have the disorder, which is much less common. Individuals with hemophilia lack or have insufficient levels of certain proteins called clotting factors, which are essential for the complex process of blood coagulation. There are two main types of hemophilia: Hemophilia A, which is due to a deficiency in clotting factor A8, and Hemophilia B, which is due to a deficiency in clotting factor 9. Both types can cause similar symptoms and complications. In essence, imagine our blood vessels as a network of pipes. When a pipe springs a leak, our body immediately dispatches tiny workers, platelets, and clotting factors to the site. These components work together to form a plug or clot that seals the leak and prevents further bleeding. When a pipe springs a leak, our body immediately dispatches tiny workers, platelets, and clotting factors to the site. They work together to plug the leak, preventing excessive bleeding. However, in individuals with hemophilia, the team is missing a crucial member, making it difficult to seal the leaks effectively. They work together to plug the leak, preventing excessive bleeding. However, in hemophilia, the team is missing a crucial member, making it difficult to seal the leaks effectively. This inability to form stable clots can lead to prolonged bleeding, even from minor injuries. However, in hemophilia, the team is missing a crucial member, making it difficult to seal the leaks effectively. This inability to form stable clots can lead to prolonged bleeding, even from minor injuries. While most people's blood would quickly form a clot to stop bleeding, a person with hemophilia might continue to bleed for an extended period. This inability to form stable clots can lead to prolonged bleeding, even from minor injuries. While most people's blood would quickly form a clot to stop bleeding, a person with hemophilia might continue to bleed for an extended period. This can range from nosebleeds that are difficult to stop, to more serious internal bleeding into joints or muscles. While most people's blood would quickly form a clot to stop bleeding, a person with hemophilia might continue to bleed for an extended period. This can range from nosebleeds that are difficult to stop to more serious internal bleeding into joints or muscles. Internal bleeding can cause pain and swelling and, if left untreated, can lead to permanent damage. This can range from nosebleeds that are difficult to stop to more serious internal bleeding into joints or muscles. Internal bleeding can cause pain and swelling and, if left untreated, can lead to permanent damage. It is crucial to remember that hemophilia is not contagious to more serious internal bleeding into joints or muscles. Internal bleeding can cause pain and swelling and, if left untreated, can lead to permanent damage. It is crucial to remember that hemophilia is not contagious. It is a genetic condition, meaning it is passed down through families and cannot be transmitted through casual contact like the common cold or flu. It is crucial to remember that hemophilia is not contagious. It is a genetic condition, meaning it is passed down through families and cannot be transmitted through casual contact like the common cold or flu. Understanding the genetic nature of hemophilia is important for managing the condition and providing appropriate care. It is a genetic condition, meaning it is passed down through families and cannot be transmitted through casual contact like the common cold or flu. Understanding the genetic nature of hemophilia is important for managing the condition and providing appropriate care. Genetic counseling can help families understand the risks and implications of hemophilia and guide them in making informed decisions about family planning and treatment options, and cannot be transmitted through casual contact like the common cold or flu. Understanding the genetic nature of hemophilia is important for managing the condition and providing appropriate care. Genetic counseling can help families understand the risks and implications of hemophilia and guide them in making informed decisions about family planning and treatment options. With proper medical care and support, individuals with hemophilia can lead healthy and active lives. Blood clotting is a fascinating and intricate process, a carefully orchestrated cascade of events designed to prevent excessive bleeding after an injury. This process is vital for our survival, as it ensures that even minor cuts and bruises do not lead to significant blood loss. It involves a complex interplay of various components, including platelets, clotting factors, and blood vessels. Each of these elements plays a crucial role in the clotting process, working together in harmony to form a stable blood clot. Imagine a chain reaction. One event triggers the next. This sequence of events is known as the clotting cascade, and it is essential for the formation of a stable blood clot. When a blood vessel is damaged, it constricts to reduce blood flow. This initial response helps to minimize blood loss and sets the stage for the subsequent steps in the clotting process. Immediately, platelets, tiny cell fragments in our blood, rush to the site, sticking to the damaged area like tiny patches. These platelets form a temporary barrier to help stop the bleeding. This forms a temporary fragile plug. While this plug is essential, it is not strong enough to withstand the pressure of blood flow on its own. However, this initial plug needs reinforcement. Without additional support, the plug would quickly break down, leading to continued bleeding. This is where clotting factors come into play. These proteins are essential for stabilizing the initial platelet plug and ensuring that the clot remains intact. These specialized proteins act like glue, binding to the platelets and weaving a strong mesh-like structure to secure the clot and stop the bleeding. This mesh is made up of fibrin, a protein that forms long thread-like strands. In individuals with hemophilia, this process is disrupted. The absence or deficiency of specific clotting factors prevents the formation of a stable fibrin mesh. The deficiency or absence of specific clotting factors, particularly factor 8 in hemophilia A and factor 9 in hemophilia B, weakens the clot's integrity. Without these crucial factors, the clotting cascade cannot proceed normally. As a result, the initial plug formed by platelets is not adequately reinforced, leading to prolonged and potentially dangerous bleeding episodes. This can cause significant health issues, as even minor injuries can result in severe blood loss and complications. Hemophilia is a genetic disorder, meaning it is caused by mutations or changes in specific genes. These mutations can be inherited from a parent or can occur spontaneously. These genes carry the instructions for producing the essential clotting factors, primarily factor 8 and factor 9. Clotting factors are proteins in the blood that work together to stop bleeding by forming a clot over a wound. When these genes are altered, the production of these factors is disrupted, leading to hemophilia. This disruption means that even a minor injury can result in prolonged bleeding, which can be dangerous and sometimes life-threatening. The inheritance pattern of hemophilia is X-linked recessive. This type of inheritance means that the gene causing the disorder is located on the X chromosome, one of the two sex chromosomes. This means the genes responsible for these clotting factors are located on the X chromosome, one of the two sex chromosomes. The X chromosome carries many genes that are important for various bodily functions. Females have two X chromosomes, XX, while males have one X and one Y chromosome, XY. This difference in chromosome composition plays a crucial role in how hemophilia is inherited and expressed. Since males inherit their X chromosome from their mother and the Y chromosome from their father, a male child who inherits the X chromosome carrying the mutated gene will develop hemophilia. This is because males have only one X chromosome, so there is no second X chromosome to compensate for the defective gene. On the other hand, females have two copies of the X chromosome. This means that if one X chromosome carries the mutated gene, the other X chromosome can often compensate by producing enough clotting factors. If a female inherits one X chromosome with the mutated gene, she becomes a carrier. Carriers usually do not experience symptoms because their second X chromosome can produce the necessary clotting factors. Carriers usually do not experience symptoms but can pass the gene to their children. This means that a carrier mother has a 50% chance of passing the mutated gene to her sons, who will then have hemophilia, and a 50% chance of passing the carrier status to her daughters. Living with hemophilia presents unique challenges. The severity of symptoms can vary greatly depending on the individual's clotting factor levels. Some individuals may experience mild bleeding episodes, while others might have more frequent and severe bleeding. One of the most common symptoms is spontaneous bleeding into joints, particularly the knees, elbows, and ankles. This can cause significant pain, swelling, and stiffness, limiting mobility and affecting daily activities. In some cases, repeated bleeding into joints can lead to chronic joint damage and arthritis. Another concern is internal bleeding, which can occur in muscles, organs, or the brain. Internal bleeding can be particularly dangerous as it may not be immediately apparent and can lead to serious complications if left untreated. Early signs of internal bleeding can include unexplained pain, swelling, or bruising. It is crucial for individuals with hemophilia to be aware of these symptoms and seek prompt medical attention if they suspect internal bleeding. While there is currently no cure for hemophilia, significant advancements in treatment have significantly improved the lives of individuals living with the condition. The primary goal of treatment is to prevent and control bleeding episodes, allowing individuals to live active and fulfilling lives. The cornerstone of hemophilia treatment is replacement therapy. This involves intravenously administering concentrated forms of the missing clotting factor, essentially replenishing the body's supply and restoring the blood's ability to clot effectively. There are two main types of replacement therapy: prophylactic and on-demand. Prophylactic treatment involves regular scheduled infusions of clotting factors to prevent bleeding episodes. On-demand treatment, as the name suggests, involves administering clotting factors when bleeding occurs or before a planned surgery or dental procedure. In recent years, the development of extended half-life clotting factors has been a significant breakthrough. These factors remain active in the body for more extended periods, reducing the frequency of infusions and improving patients' quality of life.